Here is a quiet truth almost no one will share with you during a brief 7-minute medical consultation. The figure appearing on the blood pressure monitor is not actually your blood pressure. Let that sink in for a moment. It sounds completely counterintuitive because you watched the device with your own eyes and saw the crisp digital readout, and a mechanical instrument cannot deceive you. You are entirely correct that the equipment is not falsifying data, but that specific measurement is only accurate for one fleeting split second under a precise combination of circumstances. Crucially, those circumstances rarely reflect the everyday state of your cardiovascular system. The hardware is truthful, but the exact instant it captures you is where the issue lies. For a vast number of individuals over the age of 60, that single honest data point has quietly triggered a serious consequence by branding them with a medical diagnosis they might not actually have, frequently accompanied by a prescription bottle to match. No one is acting maliciously in this scenario. A frantic clinical space is simply the result of a busy schedule. However, a healthcare framework optimized for velocity was never engineered for precision, and you are the one who bears the consequences of that trade-off, not the clinic. Therefore, I intend to provide you with the time and explanation your brief consultation omitted. By the conclusion of this discussion, you will comprehend why your actual blood pressure may differ significantly from the alarming figure you initially saw, and you will discover precisely how to identify your true baseline. As a brief preliminary detail, if your specific clinical situation involves your body retaining excess fluid, a common occurrence for various individuals past 60, the gentle introductory program I created, known as the Fluid Drainage Protocol, is provided in the resources below. It represents a minor supportive tool rather than a medical treatment, and it should absolutely never serve as an excuse to avoid your physician. That comprises everything I will mention regarding that resource, so let us return directly to the main metric. Allow me to state explicitly what the vast majority of people assume to be true, given that it is a completely logical belief rather than a foolish one. You naturally assume that when the monitor displays a reading of 150/90, your actual blood pressure is precisely 150/90. You believe an elevated metric indicates chronic hypertension, and you assume that if the numbers remain elevated, a prescription medication is the inevitable next step. None of those assumptions are inherently unintelligent. In fact, for a specific segment of the population, every single part of that statement is entirely accurate. I will address those individuals specifically toward the end of our discussion, because the concepts I am about to explain do not apply to their situation, and misinterpreting this information could result in genuine harm. However, for millions of other individuals, this perspective is not fundamentally incorrect so much as it is merely incomplete, and the absent detail happens to be the most vital factor of all. Consider why this assumption has taken such a powerful hold on our collective mindset. A number inherently feels objective. It possesses no personal opinions, it avoids flattery, it does not intentionally try to scare you, and it merely presents itself in those sharp, illuminated characters. Clean digital data easily mirrors absolute truth, and furthermore, the professional interpreting the data typically wears a clinical white coat. You have been socialized your entire life to place your confidence in that attire, so when the technology and the professional align, you naturally feel you have no ground to question both simultaneously.
That baseline instinct is actually a constructive one, and I am not suggesting you abandon it entirely. Instead, I am asking you to integrate a single additional concept into your perspective, and once you grasp it, you will never view a blood pressure monitor the same way again. Before introducing this concept, let me describe the exact scenario that frequently unfolds, as I suspect it aligns with the experiences of many individuals watching this. You enter the clinic feeling perfectly healthy and entirely like yourself. The cuff is secured around your arm, the resulting metric is elevated, and the entire atmosphere in the clinical room immediately shifts. Suddenly, you hear terminology like hypertension, cardiovascular risk, and the phrase, "We need to monitor this closely." You walked into the building perfectly healthy, yet you depart carrying a chronic diagnosis, all triggered by a solitary measurement. From that point forward, the situation frequently intensifies like a snowball rolling downhill. You receive a follow-up appointment, followed perhaps by a low dosage of a medication, which then shifts to a slightly higher dosage, ultimately leading to dizzy spells when you stand up too quickly and a lingering sense of anxiety whenever you notice your own pulse at night. This entire trajectory can originate from one single measurement captured during one highly unfavorable moment. You deserve to discover whether that specific moment reflected reality, which brings us to a quiet piece of information that is rarely explained. The genuine medical definition of hypertension is not merely a high number, it is an elevated reading captured specifically at rest. The physiological condition is defined by how your circulatory system behaves when your body is entirely tranquil and settled, not by how it responds after you have hurried across a parking lot and scaled an examination table. Consequently, the exact instance when the vast majority of clinical measurements are taken is precisely the one moment the official medical definition instructs us not to rely upon in isolation. Keep that realization in mind, as we will return to it shortly. Here is the core concept. The external variables surrounding the measurement process can alter that digital readout far more than your actual cardiac health does. Let me share genuine statistics with you because vague assertions fail to help anyone. These metrics originate directly from the American Heart Association's published research regarding measurement deviations, and I want you to visualize each scenario occurring during a routine doctor's visit. Wrapping the blood pressure cuff directly over a clothing sleeve rather than against bare skin can artificially inflate the reading by as much as 50 points. A single deviation of that magnitude can elevate a perfectly healthy individual into a highly alarming diagnostic tier. Why does this distortion occur? The fabric folds in bunches beneath the inflated cuff, altering how the mechanical force applies to the underlying artery, and the automated monitor interprets that physical interference as actual arterial pressure. Similarly, an unemptied bladder can elevate the final metric by an additional 10 to 15 points. While that sounds almost comical, a genuine physiological explanation exists. When your bladder is full, it subtly activates the body's natural stress and survival mechanisms, which automatically constricts your blood vessels. Therefore, simply needing to use the restroom, a state you frequently find yourself in after sitting for prolonged periods in a waiting area, escalates your internal pressure before the machine even begins to operate. Allowing your arm to dangle passively at your side or holding it aloft in the air rather than keeping it comfortably supported at the physical level of your heart can add up to 10 points to the result. This happens because your cardiac muscle must work slightly harder to overcome gravity, and the automated device registers that temporary additional exertion. Crossing your legs at the knee or slumping without proper lumbar support introduces another 6 to 10 points. The act of crossing your legs mechanically compresses the major blood vessels located behind the knee, forcing your system to work harder to circulate blood, which immediately spikes the readout. Engaging in conversation during the measurement process, even polite small talk or simply listening to a clinician's question, can add roughly 10 points to the total. Furthermore, utilizing a cuff that is fundamentally too small for a larger arm adds another 2 to 10 points because the bladder must constrict with greater force to perform its function, and the software misinterprets that mechanical resistance as elevated arterial pressure. Certain lifestyle variables do not dissipate as rapidly as you might hope, such as consuming a morning coffee. Caffeine does not merely cause a fleeting spike in your circulatory metrics. Once it enters your bloodstream, it can maintain vascular constriction for several hours, and no amount of controlled breathing in the reception area will reverse that physiological reality. Consequently, a morning coffee enjoyed at 8 o'clock a.m., an appointment scheduled for 9 o'clock a.m., and an elevated reading captured at 9:15 a.m. do not represent three isolated occurrences. They form a single interconnected chain of events. The identical rule applies to smoking a cigarette prior to entering the clinic or rushing briskly to arrive on time, as your physiology retains the physical exertion long after you have taken a seat. Now, perform the basic calculation in your head. You do not require every single one of these procedural errors to distort your results. You merely need 2 or 3. Experiencing 2 or 3 errors does not represent an extreme anomaly. It constitutes a completely ordinary Tuesday inside a frantic medical facility. Visualize the standard sequence. You park your vehicle, walk inside, and sit in the reception area with a full bladder. They call your name, you walk down a corridor, and you climb directly onto the examination table. The cuff is wrapped over your clothing sleeve, your arm rests unsupported in your lap below heart level, and while the device inflates, a staff member asks how your week has been, prompting a natural verbal response. That single scenario combines the sleeve, the full bladder, the dropped arm, and the active conversation, four distinct procedural errors stacked together before the final figures even materialize on the screen. That discrepancy does not represent a minor statistical fluctuation. It spans the entire diagnostic distance between being perfectly healthy and being labeled with a chronic disease. There is one specific research statistic that should cause you to stop completely and reflect. A consensus report published within the Journal of Hypertension calculated that a systemic measurement deviation of a mere 5 points could mistakenly push approximately 84 million individuals worldwide into an incorrect elevated blood pressure classification. A 5-point difference is simply the physical reality of a full bladder, a sleeve left unrolled, or the consequence of a single omitted preparation step. This issue extends beyond mere clinical technique. It involves the psychological impact of the clinical environment itself. There is a widespread misconception that deserves to be retired permanently. The myth that your physiology behaves identically inside an examination room as it does within your own home. It simply does not. For a massive portion of the population, blood pressure systematically runs higher inside a medical facility than it ever does within their own living room. The human nervous system naturally reacts to the clinical environment itself. The white coats, the paper gowns, the waiting periods, and the ambient anxiety regarding potential diagnostic findings. The resulting measurement is technically real, but it is evaluating your situational anxiety just as much as it is measuring your arterial health. This phenomenon possesses an official medical designation, white coat hypertension, which describes a pattern where metrics are elevated in an office setting but completely normal during ordinary daily life. This pattern is far from rare, particularly within our specific age demographic. In one study evaluating older adults living independently within their communities, the white coat pattern manifested in nearly half of the participants, showing a particularly high prevalence among individuals in their 70s. Additional medical research demonstrated that clinical office readings systematically exceeded properly conducted home measurements by roughly 7 to 8 points on the top systolic number alone. Here is the statistic that carries the greatest significance. Among individuals flagged with an elevated reading inside a clinic, data suggests that up to 1 out of every 3 patients may not actually suffer from sustained hypertension when evaluated correctly outside of that environment. 1 out of 3 does not represent a minor statistical rounding error. It equates to millions of individuals navigating life with a chronic medical diagnosis handed to them solely by the environment of the room. A familiar sequence unfolds in medical offices every single day. An individual in their late 60s who feels entirely well arrives for a completely unrelated medical concern. The cuff registers a single elevated reading. No one permitted the patient to rest for 5 minutes. No one adjusted the clothing sleeve, and by the time they exit the building, a new diagnostic term is entered into their medical chart alongside a new prescription bottle in their bag, constructed entirely on the evidence of that single moment. This does not occur because of malicious medical practices. It is merely the velocity of a frantic workday quietly dictating a lifetime decision that a single week of systematic home tracking might have easily disproven. If no one has ever taken the time to sit down and explain these variables to you, that omission is precisely why this platform exists. Consider subscribing, as we will continue to untangle complex topics like this one until the full truth is completely revealed. However, before you swing too far toward the opposite conclusion and assume that clinical measurements are invariably false and elevated, I owe you the alternative half of the medical reality to ensure your safety. There is a precise mirror image to white coat hypertension, and it behaves in a much more deceptive manner. It is medically categorized as masked hypertension. This condition occurs when your office measurements appear perfectly normal, yet your actual blood pressure remains dangerously elevated throughout the rest of your daily life out in the real world, where no clinical instruments are actively tracking it. While the white coat variation misleads you into believing you are ill, the masked variation misleads you into believing you are perfectly healthy. Consequently, the masked variety is, if anything, significantly more perilous precisely because it encourages everyone involved to relax their vigilance. This dynamic is the exact reason I am not advising you to diminish your trust in clinical data in favor of relying on raw intuition. Rather, I am encouraging you to place your trust exclusively in a comprehensive pattern. When measured correctly over an extended duration, a consistent pattern is the only honest witness available to you.
There is one additional diagnostic habit against which I must firmly warn you, and it represents perhaps the most consequential misstep of all: the single reading diagnosis. You enter an office, the monitor displays a high number once, and a definitive clinical decision is reached immediately on the spot, frequently a decision that accompanies you for the remainder of your life. However, a solitary measurement was never epidemiologically intended to diagnose a chronic medical condition in isolation. All major international cardiovascular guidelines are explicitly structured around measurements captured across multiple separate encounters, frequently spanning entirely different days, precisely because of all the variable distortions we have just analyzed. A legitimate medical diagnosis represents the mathematical average of numerous distinct moments, not a life sentence handed down by a single instance. To express this as simply as possible, a single high reading is merely an individual ocean wave. It indicates that the water is capable of rising, but it fails to prove that the entire sea level is permanently elevated. To understand the actual behavior of the sea, you must observe it long enough to discern the underlying tide itself, rather than reacting exclusively to the one specific wave that happened to crest while someone was actively watching. Therefore, if the number displayed on the monitor is not your definitive blood pressure, what actually is? To answer that question honestly, you must comprehend a fundamental reality regarding your own physiology that no isolated measurement can ever reveal. Your blood pressure is not a static, unvarying value. It is never comprised of a single permanent number. It functions precisely like a tide. Picture the ocean. The sea possesses a measurable depth, but if I were to ask you exactly how deep the ocean is, the only accurate answer is that it depends entirely on the moment you measure it. The tide advances and recedes continuously throughout the day, pulled by lunar gravity and altered by atmospheric winds and localized storms. Now imagine you walk down to the shoreline at the absolute peak of high tide in the middle of a powerful gale, measured the waterline against a wooden post, returned home, and painted that single resulting metric onto a permanent sign by the roadway stating, "This is the depth of the sea." You would be completely incorrect regarding that ocean for nearly every other hour of the day. Your circulatory system behaves in the exact same fashion. Your pressure climbs the moment you stand upright from a chair. It escalates when a sudden phone call startles you. It surges when you carry heavy bags of groceries up a flight of stairs, and it subsequently drops down low and tranquil in the quiet hours of the night while you're sound asleep. That continuous rise and fall does not represent a physical malfunction. It is your body executing its normal biological function second by second through the mechanisms of the sympathetic nervous system. This is the fight or flight biological machinery that accelerates your heart rate and constricts your vascular pathways the instant your system perceives any form of external or internal stress.
Consider what that biological machinery is actively experiencing inside a medical facility. The chilly walk from your car represents a gust of wind across the water. A crowded, noisy waiting room adds another layer of turbulence. The physical act of climbing onto an examination table and holding yourself upright raises the internal tide. The lingering worries regarding healthcare costs, diagnostic outcomes, or your body weight all function as passing weather conditions on that open sea. By the time the cuff begins to inflate, your system is effectively being evaluated at absolute high tide during an active storm, and the resulting metric captured by the machine is completely real. It is simply not representative of the entire ocean. There is a distinct circadian rhythm to this process across every 24-hour cycle. In the vast majority of individuals, blood pressure naturally climbs during the hours immediately surrounding waking, a normal morning surge as the physiology prepares itself for the day ahead. It subsequently eases downward throughout the evening and reaches its lowest point during the quiet early hours of the night. That daily fluctuation is completely healthy and expected, serving as one more reason why an isolated reading captured at a single time of day can severely mislead you. Your morning self and your midnight self can register starkly different metrics, and both values are entirely truthfully characteristic of your body. That fundamental concept, that your pressure functions as a fluid tide rather than a static line, is the exact insight a brief 7-minute appointment never provides you the time to understand. Now we reach the perspective that recontextualizes this entire topic, because that exact same concept explains precisely when an elevated number is not a temporary measurement anomaly, but rather a genuine medical emergency unfolding in slow motion. True chronic hypertension, the specific medical condition that progressively damages your cardiac muscle, your kidneys, and the delicate vessels in your eyes over the decades, is not defined by a passing high tide. It occurs when the water level remains dangerously elevated even during low tide. Let that concept sink in completely, because it represents the core takeaway of this entire discussion. Genuine high blood pressure remains elevated in the morning before you have even stepped out of bed. It remains elevated in the evening while you are relaxing on the couch. It remains high when you are completely calm, rested, and in the comfort of your home with absolutely nothing causing you anxiety. When the sea level simply refuses to recede, and even the most tranquil hour of your day still produces an elevated reading, you are no longer dealing with a temporary measurement error. You are witnessing the actual medical condition. The genuine condition never improves by being ignored. Instead, it deteriorates in total silence, which is precisely how it earned its historic medical moniker as the silent killer. Therefore, the objective of this discussion was never to persuade you to stop caring about your cardiovascular metrics. The objective is to prevent you from being clinically categorized based solely on the evidence of a single high tide, and to ensure with absolute certainty that if your baseline water level truly is remaining high, you are the one who identifies it. Detecting that pattern matters more than almost any other health measure you can take for yourself at this stage of life. Undetected, chronically high pressure persisting year after year is one of the primary reasons individuals experience a sudden stroke they never anticipated, a heart that progressively struggles to keep pace, or kidneys that quietly lose functional capacity. None of those outcomes advertise themselves in advance. They simply accumulate damage incrementally over time. That is why tracking your metrics accurately is not rooted in fear at all. It is about actively identifying a variable that inflicts its damage without ever requesting your awareness or permission. Here is the practical roadmap of what to actually execute, because understanding the concept of the tide only benefits you if you learn how to read the shoreline yourself on your own schedule. The objective is incredibly straightforward. Cease evaluating your cardiac health based on a solitary number captured at high tide in a high-stress environment, and begin observing the comprehensive pattern over multiple days within the environment where you actually live your life. First, acquire a reliable home blood pressure monitor, specifically the style utilizing an automated cuff that wraps securely around your upper arm rather than the wrist-based models. Many wrist devices yield highly variable and less dependable metrics. Search for an instrument that has been independently validated for diagnostic accuracy. Your local pharmacist can easily direct you toward a certified model if you ask for one by name. Next, prepare your environment and body exactly as the American Heart Association dictates, noting that almost every single step is fundamentally designed to let your internal physiological tides settle completely. For the 30 minutes prior to your measurement, consume no caffeine, avoid tobacco products, and engage in no strenuous physical exercise, as all three variables temporarily elevate the baseline watermark. Empty your bladder completely, given that a full one subtly drives the numbers upward. Afterwards, sit quietly in a tranquil space and do absolutely nothing for 5 continuous minutes. Individuals bypass this specific step constantly, yet it represents perhaps the most vital component of the entire process. You are actively waiting for the environmental wind to die down and for your fight-or-flight nervous system to fall completely silent. When you are ready to begin, sit comfortably with your spine fully supported against the back of the chair and both feet resting flat on the floor. Do not cross your legs at the knees or ankles. Roll your clothing sleeve up completely and position the cuff directly against bare skin, ensuring the lower edge sits roughly an inch above the bend of your elbow. Rest your arm flat on a desk or table so the cuff sits at the exact physical level of your heart, sliding a supportive cushion underneath if you require extra height to achieve that alignment. Finally, observe the rule that proves most challenging for the majority of us. Maintain absolute silence. Engage in no conversation. Avoid looking at your smartphone and turn off the television, allowing the machinery to perform its function in total quiet. Execute 2 distinct readings spaced exactly 1 minute apart. Perform this routine once in the morning before you ingest any daily medications, and repeat the process once more in the evening, ensuring you utilize the identical arm every time so you are consistently comparing matching data points. Record each individual metric on paper or allow the monitor's internal digital memory to store them automatically. Maintain this tracking routine for several consecutive days rather than a single day, because an isolated measurement taken at home is still merely a single moment in time. What you are actively constructing is not a temporary snapshot. It is a comprehensive chart of your personal tide across an entire week. Bring that completed data log directly into your subsequent medical consultation. A full page of systematically recorded home metrics gathered properly over several days narrates a vastly more accurate clinical story than a single hurried measurement captured on an examination table. It represents the most profoundly useful diagnostic tool you can possibly bring through that clinic door. It fundamentally shifts the clinical dynamic from a scenario of the machine dictates you have a disease into a collaborative conversation of here is how my cardiovascular system actually behaves throughout the week. That represents an entirely different interaction, one where you function as an active healthcare partner rather than the passive recipient of a clinical verdict. Do not allow a solitary anomalous number to cause you anxiety. If an individual reading suddenly spikes for no apparent reason, simply take a deep breath, wait a few quiet minutes, and measure again. You are evaluating the overarching trend across the entire week rather than emotionally reacting to every passing wave. A home monitor is intended to serve as an instrument for patient observation, not as a trigger for panic. Many individuals who initiate tracking in this systematic manner discover that their baseline numbers are far steadier and noticeably lower than the clinical office data ever implied, for the simple reason that the situational stress of the clinic has been entirely removed from the equation.
Now, I must be completely unequivocal about a critical boundary, because everything I have detailed could easily be misinterpreted, and misapplying this information could genuinely jeopardize your health. I am absolutely not suggesting that hypertension is a medical myth. I am not telling you to casually dismiss an elevated reading, and I am most definitely not instructing you to halt or alter any prescribed medication on your own initiative. High blood pressure is a dangerous objective reality. It is remarkably prevalent, and when left unmonitored, it serves as one of the primary hidden drivers of strokes, heart failure, and permanent kidney damage. Our entire discussion tonight has centered strictly on measuring the condition with absolute honesty, never about dismissing its severity. Consequently, here is the clear, non-negotiable boundary. If your home metrics systematically return high, high in the morning, high in the evening, and consistently elevated when you are entirely relaxed, rested, and calm in your own living room, then you are not dealing with a white coat effect, a rolled-up sleeve, or a full bladder. That readout represents your genuine baseline internal tide, and it is truly elevated. That scenario constitutes a definitive reason to consult your physician immediately, not a reason to relax. Properly measured, consistently high numbers have fully earned your focused medical attention. Furthermore, there is one specific tier of measurement that represents an immediate, absolute medical emergency. If you ever capture a reading that registers around 180 over 120 or higher, sit down quietly, rest for a few minutes, and measure a second time. If the metric remains at that elevated level, contact your healthcare provider right away. If a number of that magnitude manifests alongside symptoms such as chest discomfort, shortness of breath, difficulty speaking, sudden physical weakness, or acute alterations in your vision, do not waste time retesting and do not wait to see if it passes. Contact emergency services immediately. That specific scenario is not a situation for home observation. To state it as plainly as possible, one final time, never alter a single medication dose based on your home tracking without directly consulting the professional who authorized the prescription. Bring them your logged numbers and let the two of you decide together. Your home chart exists to enrich and inform that clinical conversation, never to replace it. I genuinely want to hear about your experiences now because your feedback actively directs the concepts I research for future discussions. Please share your current decade in the comments section below. Are you navigating your 60s, your 70s, or your 80s? The statistical pattern of white coat deviations shifts noticeably as the body ages, manifesting with greater frequency in certain decades than in others, and understanding precisely who is watching on the other side of this screen alters which safety guidelines I emphasize most heavily. Simply dropping your specific decade in the comments is more than enough. As you leave this discussion, I want you to remember this core perspective. The blood pressure cuff is a witness, not a final judge. It can tell you with total honesty exactly what it observed in one single, isolated second. However, one solitary moment captured in a stressful room with your sleeve bunched up, your legs crossed, and an anxious question hanging in the air does not constitute a definitive verdict on your cardiac health. You possess every right to request that the measurement be conducted properly in the clinic. You have every right to return to your doctor with a full week of your own accurately tracked home data in hand, and you absolutely deserve to understand the profound difference between a passing high tide and a sea level that never recedes. The vast majority of people are never told that this difference even exists. Now you know the truth, so go forth, observe your own internal tide, and ensure that whatever medical decisions are reached regarding your heart are constructed on a foundation of absolute reality rather than a single passing storm.